Hello everyone. It's April 17th. This is day 33, week 5 since the closure of our day programs and the suspension or conversion of many of our services from face-to-face to remote. Our residential division continues to operate, but now our homes are being staffed 24 hours a day, 7 days a week, as people are not attending their day programs or going to their places of employment. Today, I want to take this opportunity to share some of the latest developments at HMEA. Over the past 3 to 4 weeks, we converted our Millbury Day program into an isolation center for those we support residentially who are diagnosed with COVID ID or a presumptive case that do not require hospitalization. The center is not open to the public. It's for the people we support, and it's staffed by HMEA employees. This location affords staff and the individuals with maximum protection using PPE, personal protective equipment. It has private rooms for those who require total isolation. It's a spacious layout, so it offers plenty of room for social distancing. There is daily on-site nursing, patient assessment, and supports. And the site offers staff a separate area to relax, sleep, and eat while not on duty. Staff are provided with all meals daily. This past Sunday, we had our first isolation center admission of one of our residents who had a presumptive case of COVID-19, which was later determined to be positive. Incredibly, we had our first support staff step forward to support this individual one-on-one in the center for 24-hour shifts for several days. This single act of kindness has made all the difference in the world to this individual who was sick and frightened, but this staff made him feel secure. I also want to shout out to the other employees who have volunteered to work at the site, who are from our day programs, nursing staff, and administrative staff. I can't name all the names here today. Your work, all of you, what you've done is noticed. It's noticed by the people you support and by all of us. The isolation center pay rates for direct support staff are $27 an hour for a wake and $20 an hour for a sleep. These same rates will also be paid in homes where there's a positive case of COVID-19 where the individual is being isolated in their home. Over the past week and a half, we have also had 3 staff who have tested positive. 2 are quarantining in their home. I understand they're doing well, and 1 has been hospitalized. All the staff and individuals at the home that supported the person who moved into the isolation center were tested, and I'm so happy to say that all results were negative. On a positive note, the state has partnered with Fallon Ambulance and Mass Health to begin mobile testing of individuals in our home who are displaying virus symptoms or have been exposed to someone who has tested positive. All the individuals in that home and the staff who work within that home can be tested on site through the mobile testing facilities for free. And the test results are expected to return within 1 to 3 days. Our experience is it took 2 days at this particular site. Over the past 2 weeks, We have had staff from 2 of our homes agree to shelter in place, or let's call it a live-in model, in order to minimize potential virus exposure of the people they support and themselves. We recognize that 24-hour-a-day shifts for prolonged periods of time comes with great sacrifice to our employees as it separates them from their loved ones. So we are very grateful. The pay rates for live-in or shelter-in-place models are time and 1/2 of the enhanced rate that we've added $2 to each hour for the awake hours, and it's $14.75 for asleep hours. The daily standard schedule in those models are 14 hours awake and 10 hours asleep. Managers who work direct support hours in the live-in programs will also be paid time and 1/2 of their pay rate for awake hours and $14.75 for asleep hours. As an ongoing effort to reduce or contain potential virus exposures within our community, we're exploring the implementation of the live-in model throughout our residential division and have asked program managers to solicit your interest and ability to move into a home for 1 to 2 week periods. I'm sure they've already started talking to you about that. On the flip side of that, we completely understand that many of you have other obligations that would prohibit you from working under these parameters. Clearly, not every residential site will be able to convert to a live-in model based on staff's availability. So we may have different models operating throughout the residential division. If the site you work in goes to a live-in model, but you are not able to participate, you may be asked to work in another home, or you will be able to apply for unemployment benefits. Lastly, Human Services has developed and posted in the Scoop on ADP another FAQ sheet, frequently asked questions, that will answer many of the inquiries you've had about pay rates, use of ET and ELB, unemployment benefits, etc. And please remember that we have an employee assistance program that you can contact for help in a number of areas. If you do not have that number, please ask your supervisor or call Human Resources. I want to end by just saying that, we all hear a lot about the deserving people who work in the healthcare industries as being heroes, and they are very deserving of that recognition. But you, the staff at HMEA, are also heroes, working on the front lines, providing critical services to the people we support. Thanks to all the heroes in the HMEA community. I do believe we will get through this together. Thank you.